following program is classified G. It's suitable for all ages. We would like to remind our viewers that the views expressed in this program by our participating guests are solely viewpoints of them who take part and does not reflect the views and beliefs of the Derana Media Network. This is an opinion-based program.
Over 6.1 million people have died so far from the coronavirus pandemic. As of April 2022, over 490 million confirmed cases of COVID-19 have been reported from across the world from its initial outbreak. The United States and China have recently reported a surge in COVID-19 cases driven by the BA.2 variant. China reported nearly 104,000 domestic COVID-19 infections in March, with 90% of the recent cases found in Shanghai or northeastern Jilin province.
Once again, Shanghai's streets are empty. More than 2 years on from the start of the COVID-19 pandemic, China's financial hub is in one of its most extensive lockdowns yet.
It doesn't look like BA.2 is more virulent than BA.1 or cause more severe symptoms.
Waning vaccine protections and a more transmissible virus may sound like a recipe for disaster, but there is a silver lining here. Our adaptive immunity, made up of our B cells and T cells, has never been stronger.
Now, antibodies are our first line of response, but they always go down with time. 4 months after your last booster, the antibodies are going to come down with time. Luckily, we have B cells and T cells. So what do? T cells help prevent severe disease. T cell immunity is absolutely intact from the vaccines across all of the variants so far, including Omicron, including BA.2. So our protection against severe disease should be essentially there if we developed a good T-cell response.
The World Health Organization has said in its initial report that the new COVID-19 variant has been found in the United Kingdom. The WHO has said that the new mutation XE appears to be 10% more transmissible than the BA.2 subvariant of Omicron. The new COVID-19 variant is a cross between Omicron BA.1 and Omicron BA.2.
If we think of COVID strains like a family tree, you can see here the original virus branched out to two main strains. One of them then branched off into several different mutations, one being Delta, while a separate mutation formed into the Omicron variant. It produced two variants of its own, BA.1 and 2. These strains fused to create XE.
New variants have been appearing regularly from the coronavirus, and there are two ways for these new variants to appear. Firstly, through a mutation, and secondly, through a combination. The emergence of variants that pose an increased risk to global public health prompted the characterization of specific variants of interest, also known as VOIs, and variants of concerns, also known as VOCs, in order to prioritize global monitoring and research, and ultimately to inform the ongoing response to the COVID-19 pandemic. According to the CDC in the United States, a variant of concern would be a variant for which there is evidence of an increase in transmissibility, more severe disease, for example, increased hospitalization or deaths, significant reduction in neutralization by antibodies generated during previous infection or vaccination, reduced effectiveness of treatments or vaccines, or diagnostic detection failures. And a variant of interest would be a variant with specific genetic markers that have been associated with changes to receptor binding, reduced neutralization by antibodies generated against previous infection or vaccination, reduced efficacy of treatments, potential diagnostic impact, or predicted increase in transmissibility or disease severity. Although variants are common, the risk has not been neutralized. Chinese scientists wrote a paper on recombination, which is the biggest threat moving forward. In the event that COVID-19 gets into an animal, infects the animal, and exchanges genes with an animal virus that we have no experience dealing with, and comes back out, that's what we should be concerned about.
Welcome back everyone to Get Real. Time now to get some context into the conversation we are having tonight with regard to the COVID situation around the world. Try to understand how exactly is COVID behaving so that we can be tactful enough to bring in our steps taken, the governments and all around the world, people, what they need to do in order to be safeguarded from whatever the variant, whatever the version that might come in the future. COVID, if you look at around the world, we see that it is systematically, slowly becoming part of day-to-day life. Apparently nowadays we go to our supermarkets, we do everything knowing the fact that we are wearing our mask, making sure that we keep our distance, all those health guidelines. With that, we are living with COVID, and it's not as if there are no numbers, there are no new cases. It's occurring, and we are hearing variants from this side, that side of the world. Vaccinations are occurring in a very high manner, which would actually bring this particular virus, this particular pandemic to some kind of stop. And that's what we are hoping for, so our entire normal way of life can resume. So tonight I have a very special guest, and I was so lucky enough to catch him because he's here for a very short period of time. He's living in the United Kingdom. Professor Suranjith Seneviratne, welcome to the programs. I really appreciate you taking the time from your busy schedule to be here. Professor Suranjith Seneviratne is the professor and consultant in the Clinical Immunology and Allergy Institute of Immunity and Transplantation and Health Services Laboratories in London, UK, and also the Navaloka Hospital Research Education Foundation in Sri Lanka. He's part of that as well. He's also the president of the UK Sri Lanka Immunology Foundation. Lots of credentials, and it is really happy to see that a Sri Lankan is in these, high-end statuses, trying to figure out this pandemic and helping a lot. Professor, let's start with where we are in terms right now. So 2.5 years back, we heard about this pandemic, new thing. Everybody was told, go inside your home, don't come out, because we had no information back then. So the only thing we could resort to was staying at home and trying to figure out how this virus is behaving and what's its impact. 2.5 years down the line, 3 years down the line, we have a lot of information about the virus. We have already come up with a vaccine, and a lot of things have developed since then. And it has developed at a record pace, not like in the past. So what do we know about this virus right now? What have we learned thus far from 2020 onwards up until now? What exactly can we look and understand? Do we understand this virus right now?
A lot of work has been done, as you say, Mahieash, because over the past 2 years, the pace at which the virus has been studied has been phenomenal. And we have produced effective vaccines, very, very effective vaccines in a very, very short time. And they have been tested and found to be effective and safe. So initially when it came, I say in March, from January it started in China, but in March or so,
in 2020,
people just did not know about this virus, what its effects were, and it's quite a different scenario when we talk about present day. Say 2 years down the line, in March, if you get COVID, people used to COVID due to the SARS-CoV-2 virus, high chance of them getting to hospital, going to ICU, dying, etc., especially the older person and the person who had a lot of comorbidity, hypertension, diabetes, obesity, etc. Now, most of those persons have been offered the vaccine. A fair number have taken the vaccine, a good number around the world. There are certain areas that are still lagging behind, but the overall picture has changed because we are having new variants coming, but it is on the background of immunity in the population, and that's the important thing. We have immunity, 3 doses, 4th dose is coming in, but we do have background population immunity that is there at the present time. So it's quite different, and it's a phenomenal pace. vaccines. Lots of people put in resources and got the vaccines on board.
It's like the whole world had one goal, just get the vaccine done and try to find a solution for this. Professor, one of the things that we were told initially, because I think it is because of the lack of data and information we had back in 2020, what the scientist community, the medical community, people like you all were saying that the vaccination is the only solution and the whole world was moving towards that end. And when that was occurring, we were told one vaccine. We will cure this within, not a cure, it will be the fix with one vaccine. But then when we were administering the first vaccine, we were told, no, we need another one, a booster shot. Now it has come to the point where there is a third shot. Like you just said, a fourth shot. So when we were taking all these vaccines, the virus was also changing itself.
Yeah, absolutely.
So the first vaccine, what we got, and the virus, the variant of the virus we have right now, two different. Because the virus apparently studied our vaccine and morphed into a level where it wants to spread itself. Yeah. So right now we had Delta, then Delta was very effective, going all around, and it killed a lot as well. But then we had Omicron, which was spreadable, but was not that, it wasn't a killer like Delta. But now here, both of them have combined. We have something called Delta Chrome.
Yes.
So what exactly, because the virus is also changing, does this mean we have to keep taking vaccine after vaccine, whenever this virus keeps changing itself?
Very good question, Mahieash. So viruses, what do they want to do? Viruses want to spread from person to person, from cell to cell, and sort of live their lifespan. So they would mutate. When the genes in the virus will mutate, but they want to change and be able to spread more rapidly. They don't want to, there's no big survival advantage of the virus killing the host or the person. But if they can spread from person to person, that is the main thing. So viruses do evolve. Right? If you take HIV virus, that evolves very, very mutates very frequently. That is why it's so difficult to make a vaccine for HIV. Influenza mutates quite a lot. Corona doesn't mutate at that level, but still there has been mutation that have become more focused with people knowing about mutation because people have studied it. Alpha came in, beta, gamma, delta, the Delta variant, and then Omicron came. And those are the variants of concern because we have variants of interest. So as soon as a variant comes in, people say, okay, we are interested in this, and then they go into concern.
Before you continue, what exactly do the scientific community mean by a variant? Is it like, we know it's a version, like whenever we get a software update, it'll be the version of this and that. Is it a similar thing, or what exactly, is there like a drastic difference? Because for us to understand that? So
if you go back, the virus, there are the genes, and that is made up of certain letters that we denote, and if those can change, and that is called a mutation. So therefore, you find that there are, now say Omicron had about 50 different changes from the original Wuhan strain. So why do they do that? There are five effects of a change that can occur. like human beings won't change so rapidly because it's over many decades, but there are changes even in all organisms. So when you look at the 5 changes that viruses try to do, one thing is it more transmissible? Does it cause more severe disease? Does it affect testing? That is, if it's a variant and you can't detect in the standard test, that's a big problem. Next one is, does it affect the treatment we are using? Say a certain drug. Now, when Omicron came, there was a medicine called monoclonal antibody, which they were given as injection. The monoclonal antibodies that were using at the time were not effective. So there was no purpose in giving the monoclonal. And finally, which everyone is so interested in, is what is its effect on vaccine responses? Because that's the most, but that takes time to to study. So now say tomorrow if you have a variant, we just can't tell you immediately what the vaccine. So those are the 5 things, and viruses will mutate. So the important thing with Omicron was the mutation pattern when it initially came in November, towards the end of November, everyone was last year, 2021, people were quite nervous because so many mutations. But then the data from South Africa came out and said, okay, the patients were not they were not ended up in ICU and dying. But then we had to remember that South Africa, small, younger population, they had a lot of them had got COVID before, etc. So they had pre-existing immunity. That was great because it was milder sort of infection that was causing. And then we know that there was vaccine responses were reduced, vaccine effectiveness was reduced against Omicron, but that was balanced because it was milder, it was more transmissible, it was more in the throat rather than in the lungs. We just don't prefer virus to be in the upper airway rather than the lower. So it was transmissible, but it was not causing the issues in the vaccinated as we would have seen with Delta. So that is the sort of the segue into Delta Cron. So now the Delta and the Omicron, the sort of variants have merged, and now we have Delta Cron. That is the one that we have to just ensure that it doesn't take off, because if it takes off, then you're having the Delta aspects of it more dangerous, Omicron more transmissible, and that's a combined sort of a dual effect.
What's the trend you're seeing with regard to Delta Cron around the world as of now?
Yeah, so it was first considered or reported in Cyprus, but at that time a lot of people were skeptical whether it was an error, etc. And subsequently in France, cases have been reported in the UK, US, etc. So I think people are monitoring carefully, but as any scientist would say, any medic would say, it's a different scenario now because we do have immunity. So that may push us a bit more towards getting the 4th vaccine. Several have received the third dose, 4th vaccine. I'm talking about it because there are 2 groups you must remember here. First group are otherwise healthy. The second group is people with cancer, those who are taking drugs like steroids, immunosuppressive drugs that suppress the immune system, lots of comorbidities. Now, the person who is otherwise healthy, that group, and then you have the cancer patients. Cancer patients, 3 vaccines were equivalent to 2 vaccines in the healthy. That's a very important thing. So anyone with cancer should have received 3 doses as the primary. So is it
only cancer? Like in Sri Lanka, we have a lot of heart patients, we have a lot of diabetic patients, for them. So
if they have multiple comorbidities, they would have been put into the category of more vulnerable, high risk, and therefore it was especially immune deficient, the patients that we as immunologists would manage, the immune deficient, they had 3 doses, which is equivalent to 2 doses. So already the immune deficient patient, cancer patient in the UK have received their 4th dose. They have received their dose. It is effective, it's safe, etc., even in that group. While in the healthy population, those who are over the age of 75 will be getting their 4th dose because there has been a bit of waning of immunity after the 3rd dose. It was very effective, it was very helpful, it helped to blunt Omicron, etc. It was quite effective because 2 doses were not sufficient. And but the issue is that with some waning, that 4th dose will come. I mean, most people are presuming that by the autumn, that most people in Europe would be getting the 4th dose, and that will spread around the world to give the...
You also understand the fact that there are a lot of people around the world who are very skeptical about the vaccine and its ineffectiveness. And now with the number of high doses which you are expected to take, that theory is going to fly high with them, saying, look, it's not working, that kind of approach. Are we looking at multiple more doses as we go on? Because we need to understand the economics of things as well. Countries are coming to a point, especially in this part of the world, in Africa and all, still most of the countries even haven't received their first dose.
Absolutely.
It is expensive for them. So multiple doses going on and on and on, that is going to completely hit their economies. So the scientific community, for them it's easy to say, take, but then if you do not have the money or the necessary arrangements in order to take that vaccine, and if it is impacting, like the choice has now become, Professor, are you going to die out of hunger? Are you going to die out of poverty? Or are you going to die because of COVID?
Yeah.
So it's not a choice. It's either way you are going to get hammered.
Yeah.
So in an instant like that, how effective is asking people continuously take the vaccine, because it's not available free around the world. There's a cost.
Yeah.
So do you think, do you all predict, do you all understand in the future also, will we be talking about take the fifth one, the sixth one, the seventh one?
Very, I think very appropriate and very good questions, which, and there are several sort of directions to look at this. So if you take a condition like whooping cough, etc., that we have, you do need multiple vaccines, right? At least 4 doses you need when you're a child, and then you need another booster. So that is not something that is sort of new to the SARS-CoV-2 virus, or the new virus. So it has been something seen before. Influenza, we give it every year because the influenza virus mutates, and there's variation. What has been predicted when it comes to COVID or SARS-CoV-2 virus is most likely people would need a top-up of their immune responses every 2 years. It would be great if it's every 3 years, or it may come down to every year with the influenza vaccine.
If I understand right, what you're saying is every individual who got their vaccine, who got their second dose, the third dose, it'll come to a point that every year, like the normal influenza shot, which is given in the Western Hemisphere, we may have
to, but again, that has to be qualified, because we cannot go around vaccinating all people in the world every 6 months. That is not practical. As you say, there are other economic considerations. It's not only vaccinating. So you have to start targeting your populations, right? You have to target the people who are having the complications, the severe complication of COVID. Say, if you have to make a decision between a 20-year-old who is otherwise completely healthy and a 70 or 60-year-old patient with cancer, that's the group you will target. So it will come into a more targeted population, and that is why if you looked at a lot of the vaccination program, started with the oldest group, came down, then you got in. So it may come to a situation, if you are in this specific group, say cancer, immune deficiency, you may have to get it every year. Other people may have to get it every 4 years. Exactly. That's all. They may not have to get it at all because their immunity may last. So it has to be targeted. You don't just go initially everyone.
Is that something that you would even advocate for a country like Sri Lanka at this moment? Because right now, we're going through a very severe economic hardship.
Yeah.
We do not have the necessary means to buy necessary essentials in this country. So is that something you would recommend to the Ministry of Health, would recommend to our authorities to look at? Because Sri Lanka's vaccination rate is very high. We've done a really good job in terms of getting everybody vaccinated. So there's a high number of 3 doses given. Now, when it comes to the 4th dose or the 5th dose, do you think that would be the path?
Targeted, absolutely. You can't. You can't try to vaccinate the whole population. The vaccine should be given at the current time, because very small children still they have not approved the vaccine. But it should be the targeted group, because the group that is being, good epidemiological data, which the epidemiologists look at the patterns of disease, etc., would identify the target group. There's lots of data coming from other countries overseas, and lots of studies come in. Then in addition, regional data will be coming, and then it should be a targeted population rather than, so if it's a photos coming in, it should be a targeted rather than just giving a 20-year-old who is absolutely otherwise healthy.
Indeed. Let's take a short commercial break. I'm in conversation with Professor Suranjith Seneviratne, a professor and consultant in Clinical Immunology and Allergy Institute of Immunity and Transplantation and Health Services Laboratories in London, UK. We've been talking about COVID right now and its future, try to understand where the virus is going, because COVID, as you know, has taken a huge chunk from our economy. And that is what we are seeing the repercussions of it. I mean, that was not a choice. We had to do that. So right now we had to figure out how are we going to proceed with the economic issues we have, trying to figure out where we should go and be prudent when we are making decisions. Let's take a short commercial break. You're watching Get Real. We'll be right back. Welcome back everyone to Get Real. I'm in conversation with Professor Suranjith Seneviratne, Professor and Consultant in Clinical Immunology and Allergy Institute of Immunity and Transplantation and Health Services Laboratories in London, UK, and the Navaloko Hospital Research and Education Foundation here in Sri Lanka. He's also the President of UK Sri Lanka Immunology Foundation. Professor, you've been talking about vaccines and how often we need to take those vaccines. One of the important things that you said during that conversation was the medical community, the scientists prefer if the virus stays in the throat and not go into the lungs, because when it goes into the lungs is where the complication starts to occur. So that's where we have all these patients or individuals with low immunity getting infected and affected because of the fact that their lungs are, so they are finding it difficult to breathe. 2.5 years down the line, have we studied what is going to happen to the rest of our body? What about the heart? What about the liver? What about our brain? I'm sure just because it stays in the throat does not mean it has impacts all over our body. People complain about joint pains. People complain about blurry vision. For some, they suddenly have headaches, can't have the taste or the smell ability for a particular period of time. No, for some, they don't even want to eat food even after becoming okay. There are lots of complications we are seeing on a day-to-day basis, and to each individual it's different. So have you all, what is the medical community, what is the scientific community is saying about this?
So a lot of studies have been done, and data has been accumulated as we go on. And I think we have people around the world have written a lot of sort of articles and papers, etc., on effects on the liver, the gastrointestinal tract, the nervous system, the heart, etc. And there's lots of publications out, and we are taking data from the studies and applying it to actual clinical scenarios to reduce the effects on those organs. That's the important, because if you know what effects are occurring, you can reduce the effects at the time they get COVID. Now, the other part you mentioned, and which is extremely important, is this process called long COVID or post-acute COVID. So you get mild, it can be mild COVID, it can be moderate COVID, or it can be severe COVID. And after they recover, what we are seeing now in the UK, which is really important across the world, is we are seeing patients coming to us with a whole range of symptoms. Not just shortness of breath. Shortness of breath is an important thing. Cough, chronic cough. More than that, it's fatigue, tiredness, lethargy. Because we have to remember, Mahieash, when the virus comes into our body, the immune system gets activated, and it really gets sort of to a level that you don't normally see with a lot of overactivation. Then that has to come down to baseline. And in certain people, like in anything, it will come down at different rates. And there can be this residual effect that is occurring. So if we know, now say when COVID occurs, you know that sort of in a hidden way, it can damage the heart. And therefore...
How do we see that damage? I mean, would we see the pulsing of the heart slowing down, or you can't pretty much have the strength in order to do work that you usually, it was so easy for you prior to COVID?
So it's two or threefold. I mean, one important thing is it can cause something called myocarditis. So carditis is inflammation, myocardium is the heart muscle. So it can cause inflammation, and the effect of that is the process, the effect of that is people can have shortness of breath, etc. In addition, palpitation, sort of the heart beating very rapidly. Some people have their heartbeat quite low, what we call bradycardia, or the low heart rate. Blood pressure can vary. Lots of people have low reduction in blood pressure. So if they are lying down, when they get up, you can find that normally your blood pressure there should be some changes occurring. They can't, and they can feel very dizzy, etc. So those cardiac effects, and when they did MRI scans of the heart, special scan, they found that there are what we call microinfarcts, areas of the heart that have died, which we didn't know. We didn't know when you had COVID, because the investigation that were done initially, you can't detect that. But when you do special investigation for research purposes, you find that you have microinfarct. Similarly in the brain, those who had COVID, you can find that they compared those who had COVID against those who had not had COVID. They were doing some scanning, special scan. They found that though after COVID, there is slight shrinkage of the brain. So those can have long-term effect. And the process of long COVID is something that a lot of people around the world are studying. We are seeing them in clinic. We are seeing patients. Many physicians in Sri Lanka would be seeing patients with long COVID with a range of symptoms, a whole range of symptoms.
I mean, COVID was never in the radar for them because, Professor, one thing is there are individuals in this country all around the world who have got COVID, who had very mild symptoms, did not even know that you had COVID. They were just walking around doing everything what they would. But later on, then they see exactly what you just said. Let's take what you just said about the heart. If there is inflammation in the heart, that is a fast track towards a heart attack, or because there could be layers of fat that could go and residue itself on the heart walls, and that is a fast track level towards another heart attack. So what should people do now? Let's say, for a simple example, I'm experiencing those kinds of symptoms. I find myself to be really tired now, because I was not. When I wake up, I feel a little bit dizzy. Palpitations. Myself, I've experienced that. So in an instant like that, how should a person act right now? Because it's better to know about yourself rather than to be blind about everything and then go and deal with the whole repercussions of things. So what could a person do right now if they're feeling those kinds of symptoms, but COVID was never in the radar for them? They never got COVID, or they thought they never got COVID. But right now they're experiencing these kinds of things because heart patients, diabetic patients are very high in Sri Lanka.
Yes. I think, Mahieash, we have to put perspective into it. I mean, you must know, no one would suggest that every sort of complication a patient has or long-term effect is COVID. I mean, that is absolutely not on the cards. I mean, that's an important thing, because there are other more common causes of feeling tired. Vitamin D may be low, thyroid may be a problem, the thyroid gland, etc. So those have to be looked at, and you have to speak to your family doctor, your consultant, etc. But in addition, the possibility of long COVID, especially a person who we know who has had COVID, or immediately after COVID, we have to remember that it causes thrombosis, that is clotting in the blood vessels. And when there is thrombosis, there can be complications, including heart attacks. So when patients get COVID, they should ease themselves back into activity. I mean, not that you take years on end, but it should be easy. And the advice we give is if a person has been sort of a person who's doing a lot of work in the gym, etc., or running long distance, you don't start that just 2 weeks after you get an over episode of COVID. You ease yourself in. If you were going 4 miles, you'd start off with 1 mile, then you slowly build that up, gradually build muscle strength and sort of get back into the situation. But you have to be careful, especially those with comorbidities, have to be careful because of the effects of COVID, like effects on the blood vessel wall and increases the chances of clotting in the blood vessel wall, including the heart blood vessels.
If a person already had COVID, are there any kind of recommendations that you would say better you go and have a look at this? This is an area you really need to get checked, whether you are a healthy individual or whether you are in the risk category. Is there something that you would advise people to do right now?
Yes. So what I would say is, I mean, they have their own doctor, they discuss with the doctor always, you know, if you're non-medical, you always discuss with somebody who knows the area, who will discuss the aspects with you. And the second important thing to remember is, Mahieash, immune system, etc., does not only mean taking medicines, taking vaccines, and doing all these fancy things. Immune system means there are important things. Sleep sufficient hours of the day. Don't be stressed. Diet is important. Eat proper meals at regular time intervals. I mean, without sort of eating at very ad hoc time interval. Try to, if you're really stressed out, take a step back. You can't run on that. That is not good in the immune system because there's a neuroimmune response. Then the other things like vitamin D is important. I'll tell you why, because I mean, now in a country like Sri Lanka, you will think that everyone will be so replete with vitamin D. Fine, vitamin D is because we're warm country, sun, lots of sun. But lots of people don't go. I mean, they can't get much from their diet. They don't, and the levels are very low. And that is an important aspect to look at. Drink sufficient amounts of water. There are a number of patients you see in clinic who are drinking just 1 liter of water. I mean, those are the basic things.
What's the recommended amount?
I would recommend about 3, and with many people, at least 3 liters of water per day.
One of the other things right now, I don't want to scare people, but I want to get them to be educated about themselves, is the fact that what you said earlier on about the heart, that you all found that there were studies done that certain parts of the heart have died. Is that something that you can bring it back, or is it too late right now? What exactly does that mean?
So first thing is, if you can avoid a person getting repeated episodes of COVID, that would help the process.
And that can happen. Just because you got COVID once doesn't mean that you will not.
You can, yeah, absolutely. You can get repeated
episodes. And it could
episodes.
be severe just like the first time.
Absolutely, yeah. Okay. You have some immunity, so you expect it to be not as severe, but if it's a variant changes, it can be severe. So the important thing is get your immunity to the virus. Get your general immunity okay with the steps I told you. Get the immunity to the virus appropriate using vaccinations, etc. Get your other dietary factors, etc. Live a healthy lifestyle and don't be always on edge running. I mean, there are lots of things that are affecting people around the world. I mean, that we all know, economic policy, etc., economic thing. But the important thing is look after your immune system. Vaccinations will help to get some immunity so that you don't keep on getting COVID. Because if you keep on getting COVID, you're going to then increase the risk of there being thrombotic complications or clotting complications, neurological complications, liver complications, etc. So if you can prevent it, that's the best one. And when if you've had COVID, taking some steps, which I mentioned before, of trying to prevent that complication occurring. I mean, so, you know, from that point onwards, at least take a step back and say, can I live my life a bit more healthy?
It's all about tweaking to the new threats and variants that's coming into our lives. And just because you got your vaccine, just because you had COVID and got cured, does not give you the right not to wear the mask, not to keep your hands clean and keep your distance, because that is vital and still saves a lot of lives. Is that still valid?
Yes. So now it differs in different parts of the world, because the idea is this concept of living with COVID is coming into play. And when it was a pandemic, it started as a pandemic. We want to make it endemic, right? So it is not as problematic, and where people will start living their lives and getting on with economic activities. That's important for countries, because if you go down economically, you're going to have other sectors of health affected. So if your cancer patients cannot get testing done, or if they can't get the operations, etc., that is not good. If your waiting lists are. So life has to make a change. People will be coming in. Now, if you take the UK, a lot of the restrictions have been removed, while in another setting, that has to be decided according to that country setting. You cannot look at the UK and say, right, they are not wearing masks in this situation, so therefore we should not wear. I mean, you can't do that now. I travel from the UK, I will follow the rules, guidelines and rules in the country that you do. So I think it depends on the sort of the specific country that they would have to make the decisions.
True, and the thing is, what I've been saying in this program all throughout is you can't actually, it is your life, so you have to be very careful and considerate about yourself. So protecting yourself is your responsibility. Just because there is a bunch of rules or regulations, if you're thinking that the government is going to come and do it for you, it is absolutely a wrong approach. I mean, if we are making sure that we are eating healthy so that I don't get a proper heart attack early in life, if the government is not telling you to do that, but you're doing because for yourself. So like that, I think COVID also has to be considered by people. This is part of our life now. I mean, we did exercises not to have heart attacks or to be healthy. Now make sure that you keep yourself clean and do the distance and wear the mask and be proper.
Absolutely,
that is part of the lifestyle.
Absolutely, and things will improve. I mean, things will improve. It is a lot of light at the end of the time, and we are going there. Different countries will come there at different rates, at different time points, and because the pandemic affected them at different time points. I mean, if you look at it in Europe, it was raging, while in Sri Lanka we were protected. We had done the correct things, it was protected. So it will come at different point, but the important thing is sensible, data-driven approach. I mean, that's the important, not ad hoc processes, data-driven, looking at other countries, what they did and what worked and what didn't work. That's the important. Learning messages, learning lessons in this pandemic is so important as to what we can do in the future.
Exactly. Let's take a short commercial break. I'm in conversation with Professor Suranjith Seneviratne, professor and consultant in Clinical Immunology and Allergy Institute of Immunity and Transplantation and Health Services Laboratories, London, UK. We've been talking about how COVID is impacting health and especially your life. You may have to still be careful just because that vaccine or whether you got it does not guarantee the fact that you might not get it, because there's a lot of, like the good professor said, a lot of studies done how it is impacting the rest of the body. Not exactly good information that's coming out from those studies. So we have to still be careful about this pandemic. Let's take a short commercial break. You're watching Get Real. We'll be right I'm in conversation with Professor Suranjith Seneviratne, professor and consultant in Clinical Immunology and Allergy Institute of Immunity and Transplantation and Health Services Laboratories in the UK, and also part of the Local Hospital Research and Education Foundation in Sri Lanka. He's also the president of UK Sri Lanka Immunology Foundation. Professor, lots of information, really good information to the people. You spoke about, there's one thing that I want to know, and everybody wants to know, is where are we going from here? What's the next point? Because COVID came at a time the whole world was not ready.
Yeah.
We were not at all ready to manage a pandemic. We acted in different manners. We acted based on fear. We did not know what it was. But the thing is, if you look at the history of the world, pandemics have been part of the history.
Yeah.
So we were not prepared. Despite it was part of the history, we were not prepared. And COVID also was not something that was not in existence, because the coronaviruses were in existence for a very long period of time, and scientists, medical community was studying on that. Right now, this virus was taken by surprise to the medical community. And what I need to understand is, if that was the case, are we going to be surprised in the future as well? Could there be new types of viruses that have various kinds of variants and all? But as scientists, as medical professionals, you all don't just react to what's happening right now. You all are modeling, you're looking at the future. Okay, if we do this, it might react in this way. What are we going to do after that? There's a lot of study that is occurring behind closed doors. Now, what are you seeing right now with regard to COVID, and what kind of other risks is this global community might face in the future?
I think very, very appropriate and timely question, because you are absolutely correct. We were caught unawares when it comes, or flat-footed when it came to the current pandemic. The world, means the world, because everyone was focusing on influenza, and true, still we have to be careful about influenza. And coronavirus, the general coronaviruses were circulating, they were causing mild cold, etc. But then this really came and got the world thinking about other pandemics that have occurred in the past, because we can learn lessons from those that happened in the past, and that can come in the future. Because if I tell you, there are several conditions in Africa which, if we are not careful, could spread around the world. So we have to have proper surveillance, proper modeling. So there are teams of people who do model the sort of the changes that can occur, so that they can design appropriate vaccines. If I just mention a term, pan-corona vaccine, that is, if we can, every time a new variant comes, if we have to keep on changing the vaccines, etc., that won't be practical.
The
that
super
would
vaccine
not be.
for COVID.
Exactly. So, or coronaviruses, right? So if we can get that pan-coronavirus, or can we combine it to corona and something else?
Is this an idea, or is this something that actively working?
They are working on it, because the new vaccine processes that came on, 2 new processes, especially something called mRNA vaccine came on, a processor, that has revolutionized the vaccine field for not only COVID, for future organisms that can affect us, plus things like cancer and other conditions. So it's going to have a positive impact. The vaccine findings that they have, that you can design better vaccines for cancer, etc. So it's not only vaccines, there has to be proper surveillance. The world has to put in money across the world. The richer countries have to put in money to the countries that are not so well off, so that there is active surveillance. It's like COVID. Just because you control it in one part of the world doesn't mean that everything goes out of, that is fine.
What was the inability? Because I think around in 2014, 2013 onwards, Ebola virus came.
Yeah.
It popped up in Africa.
Yeah.
But it was curtailed. It was contained. It did not go all around the world. Why were we able to do that and was not able to do that?
I mean, respiratory viruses are big problems. Respiratory influenza, corona, etc. have been a big problem. Which is, if the virus is very transmissible, right, that worsens the situation. So respiratory viruses are a big issue. Ebola, they were able to control it, and in Africa, it went to several countries in Africa, but they were able to control. But when it comes to respiratory viruses, that is a problem.
What's your final advice to the people? We've gone through a pandemic. We are at the tail end of things, hopefully. Obviously, there will be new viruses, pandemics that will pop up. I think this would have given the modern world to a guideline, a handbook, allowing people, just because you have one, you don't have to scream and stop everything, because right now, the economic crisis we are experiencing all throughout the world was because of the wrong way approached the virus from the onset of COVID. COVID is the one that catalyzed all these problems, and now it has brought out into the limelight, and here we are. The things that we were not focusing on, we are focusing on now. You can look at it as a problem, but then again, you also can look at it as an opportunity for the future. So what exactly would you give, not so much to the world, but as an individual, as a person living in Sri Lanka, as a person in the UK, what would be your advice to them, saying, this is the way you got to live from now onwards?
Yes, I think that concept of living with COVID is coming, right? Because there is light. I mean, you can see positive sort of information data coming from countries that have started opening up and getting their economy back online, getting with some restrictions. You can't, you have to, and to do it in a staged fashion. I think if you look at the UK, at one time it was just open up everything. That was in 2020. Around the end of summer, they just opened up, and then again there was another big amount of transmission. Then in 2021, there was a bit more of early 21, bit more sort of gradual way, and now they are going through a process of opening up things, and there is light at the end of the tunnel. We are going to get over this pandemic, and the hope is that some other tricky variant doesn't come. But I mean, we are quite a bit of the world is immune, and that is one positive thing. So we are going to get over the thing. But the important thing is not for the for persons, the important decision makers around the world, to then say, okay, now we have got over this, now we'll take a nice siesta and forget about the possibilities of any other future. That's an important aspect to be considered, because these threats would come, health threats would come, but if we have something that is data sharing, etc. Now, South Africa, wonderful data sharing when it came to Omicron. But initially, previously, but they were penalized at one time. They were penalized.
That's the problem, isn't it? The finger pointing, the arguments, the political arguments that was going. I mean, if by any chance, if we were not bothered about blaming China, saying you started it, and focusing on a solution.
Absolutely.
A quicker response. One of the other things also what you said was very important, Professor, is the fact that we can't forget about how we did. It also showcased lots of vulnerability, especially in the West, in the healthcare systems. Sri Lanka was actually lucky because our healthcare system was geared to take care of something of this sort, but it also showcased certain vulnerabilities we have. Fixing those and making sure that it is pretty much can handle any kind of a pandemic or a cause would be the prudent way to proceed in the future. Professor Suranjith Seneviratne, thank you very much. I really appreciate your time and taking a little bit of your busy schedule to come here and have this conversation, because what you said was very valuable to the people of this country, and it is vital for us to keep this in mind rather than forgetting what's COVID. That cannot be our thought process. We have to continuously do that. That's all the time we have for you tonight. Thank you very much for joining us. As always, I say make sure that you stay positive and test negative. I'll see you next time. Good night.
We can wake up and break up, we're still young. I don't wanna forget this. I'm not gonna regret this, I'm not, no. It's so hard if you're so lost. This could be a disaster. I don't care about after, cause right now you can keep my love for yourself. I don't care about else. You can take my heart, run away with it. Run away, run away, run away with it. One-on-one with you, I'm out. I don't care about nobody else. You can take my heart, run away with it. Run away, run away, run away with it. You can take my heart, run away with it. Run away, run away, run away with it. You can take my heart, run away with it. Run away, run away, run away. I know that you're worth it. If it's you that I'm holding, I know I don't wanna forget this. I'm not gonna regret this. You can keep my love for yourself.